And while racism and its effects have been permeating this country since its founding, in the last year, Asian Americans in particular have borne the brunt of intolerable behavior at the hands of fellow Americans while suffering from the same pandemic right alongside them. The Biden administration is clear. These racist and xenophobic attacks have no place here. As in accordance with the presidential memorandum condemning and combating racism, xenophobia, and intolerance, I will lead the Health Equity Task Force in providing recommendations to advance cultural responsiveness, language access, and sensitivity towards Asian Americans and Pacific Islanders in the federal government. Additionally, the task force has been charged with providing recommendations for how agencies and state, local, tribal, and territorial officials can best allocate all COVID-19 resources. We recognize the socioeconomic and health disparities of the Pacific Islander community, in the mainland US, as well as on the US affiliated Pacific Island territories. The unique challenges that people in the US API territories face that cause chronic challenges to healthcare. The task force will take all of this into consideration as we develop recommendations for COVID-19 resource allocation. In addition to equity and access to testing, treatment, and vaccination, we must also ensure access to the scientific discoveries that propel these advances in the first place. Populations under study are rarely included in a meaningful way in the development of research. So as we center health equity and health disparities in our COVID-19 research portfolio, we need to collaborate with medically underserved communities every step of the way. These communities know about their needs in a way that medical researchers often do not. And because of this, it is both practical and right to involve them in developing the research measures, prioritizing research topics, defining ideal outcomes, and implementing projects. Communities are expert in what they need. Yet, there are institutional barriers to this deep and meaningful inclusion of communities in research. For starters, communities of color often lack the trust or interest to become involved in research. To be clear, this is due to decades longer of systemic neglect, discrimination, and mistreatment experienced at the hands of often the government as well as scientific institutions. So at the federal level, the administration is committed to building trust across community. The president and other leaders will be honest and transparent with communities, maintaining an open line of communication and providing the public with clear, scientifically backed information and recommendation. Another barrier to identifying and addressing the needs of communities, quite frankly, is the lack of cohesive and comprehensive data. Our current data and data systems simply do not accommodate the socio-demographic complexity experienced across communities. It's true, demographic data collection has improved since the beginning of the pandemic, but the data are still inconsistent and incomplete. Not only for communities of color, but for all medically underserved communities, rural communities, those who are undocumented, people experiencing homelessness, incarcerated people, and people with disabilities. We still do not know the full extent to which these communities have been affected and are suffering. Disaggregation of demographic data is especially important among Asian American and Pacific Islander groups, where disparities are concealed in collapsed categories often that do not account for the many rich cultures and ethnicities represented. This piecemeal approach to data collection is just one issue in terms of the larger, long-standing lack of the contextual data that we need to make sense of health disparities, data related to the conditions of place, environmental pollution, clean water access, as well as food and housing security and stability, access to healthcare, and so much more. So finally, we are emphasizing the need to work closely with community and faith-based organizations to be most effective and connected with community, while also working directly with state and local leadership to ensure no one falls through the cracks. We know, yes, we do, that the challenge of inequity reflects long-standing and deeply rooted systemic realities. No one is suggesting these problems can be easily solved. Yet we must attend right now to the underlying social and structural drivers as we look ahead to building resilience into our recovery. So in closing, let me say, the Biden-Harris administration is committed to a multi-pronged response strategy that is fair, that is equitable, and also efficient to ensure the protection of structurally marginalized communities as we navigate this health crisis. So thank you so much for your time today and for all that you do. Please be well.
Thank you, Dr. Nunes-Smith, for participating with us today and for your remarks. Next, I would like to introduce Congresswoman Barbara Lee, who is also providing opening remarks today. Congresswoman Lee currently represents the 13th District of California in the U.S. House of Representatives, where she serves on the House Appropriations Committee and House Committee on the Budget. She is a strong supporter of the AA NHPI community and is co-chair of the Congressional Asian Pacific American Caucus Healthcare Task Force. We are thrilled to have her today, so please join me in welcoming Congresswoman Barbara Lee.
Thank you so much for that kind introduction and for your tremendous leadership of the Asia Pacific American Institute for Congressional Studies. Madeline, let me just say your organization is truly a leader in our fight for health equity and against racial inequality. I am so proud to be a partner of yours in Congress. I must salute my good friend and chair of the Asia Pacific American Caucus, Congresswoman Judy Chu, for her bold and brilliant leadership. Also, Congressman Dr. Ami Bera, who I'm so proud to co-chair our health task force for CAPAC. I'd also like to thank you again, Madeline, for inviting me to speak with you today at your Health Summit. This is a crucial policy discussions about our current state of healthcare, which for so many is very dismal. We are facing challenging times as we eclipse the year mark of the COVID-19 pandemic. It's a time to reflect on the economic hardship and lives lost due to this devastating pandemic. We have passed the tragic milestone of over 500,000 lives lost. Millions of others have lost their livelihoods and struggle to keep food on the table. And as we all know, communities of color have been impacted the most, especially our AAPI communities. COVID-19 has laid bare the deep systemic inequality present in our public health system. And of course, we're going to continue to fight in Congress to prioritize health equity by investing in underserved communities with my COVID Community Care Act, which was included in the last COVID relief package last year, as well as in the American Rescue Plan this year. This legislation would provide funding for local organizations in medically underserved communities and communities of color to provide life-saving information and health services to their communities. It's crucial the communities have the resources to provide health and resources in a culturally and linguistically appropriate manner, especially as we ratchet up our vaccine distribution process. We must also emphasize the importance of collecting accurate health data if we want to crush this virus and to ensure that communities are being served equitably, and we must insist that the data be disaggregated. On top of our troubling health disparities, the AAPI community has suffered from hateful racism and negative stigma. The rise in anti-AAPI hate crimes and the impact on AAPI businesses are unacceptable and have been made worse by damaging lies spread by the previous administration. We must work overtime to address it, and I mean everyone must do this. Asian Americans and Pacific Islanders have made our nation more secure during the coronavirus pandemic and throughout our history. An estimated 2 million Asian Americans and Pacific Islanders have served on the front lines of this crisis as healthcare providers, as first responders, and in other essential roles. As a member of the Congressional Asian Pacific Islander Caucus, I am working very hard in Congress to address anti-AAPI hate crimes by teaming up with our great chair, Representative Judy Chu, and my friend, Vice Chair Grace Meng, who's doing a phenomenal job to combat this violence and combat misinformation and discrimination that put Asian Americans at risk. But despite all the challenges, we do have reason to be hopeful. We finally have an executive partner in the Biden-Harris administration to prioritize racial health equity and to ensure that all communities have access to the vaccine so that we can crush this virus and not go back to where we were, because that was not good for many of our communities. But we have to move forward and build back better, as the Biden-Harris White House intend to do. I appreciate you inviting me here today. I look forward to continuing to be a strong advocate with you for the AAPI community and as a partner in Congress for your work. Thank you again. Have a great health summit, and please stay healthy.
Thank you, Congresswoman Lee, for your kind remarks and for your allyship. I would like now to invite the other co-chair of the Congressional Asian Pacific American Caucus Healthcare Task Force, Congressman Ami Bera, for opening remarks. Congressman Bera currently represents the 7th District of California in the U.S. House of Representatives, where he serves on the House Committee on Foreign Affairs and the House Committee on Science, Space, and Technology. Prior to serving in Congress, he had a 20-year medical career where he worked to deliver care to thousands of Sacramento residents. Congressman Bera is also the longest-serving Indian American in Congress and is a champion for the AA NHPI community. Please join me in welcoming Congressman Ami Bera.
Thanks, Madeline, and thank you for all the work that APAICS does in giving voice to our community. I want to associate myself with the comments of Dr. Nunez-Smith as well as my co-chair, Congresswoman Lee, both who have been longtime champions in addressing not just health inequities, but inequities that are out there in the open now with this pandemic. From a health perspective, I am. I put my doctor hat on, and when we think about addressing this virus and the pandemic, we have to think about all the communities that have been impacted. And we also have to think about not just the healthcare impact of the pandemic, but the inequities in economics, the racial inequities that this virus has exposed, and really confront ourselves as a nation that is incredibly diverse. Madeline, in your opening comments, you touched on the racism and discrimination that our community is facing right now. Well, it's out there in the open, and we need to stand up, look in the mirror as a country, and address this head on and deal with it. And I think now is the time for us to do that. In addition, when I think about this moment in time and the crossroads that we find ourselves at, I couldn't be more thrilled to see the President Biden and Vice President Harris and the actions that they've taken, both to name the racism and the attacks on our community, but also to forcefully put forth policy to address this. And the legislation that we voted on yesterday, the American Rescue Plan, is going to take us a long ways to address these inequities. In that bill are specific dollars that will go to harder to reach Black and Brown communities, to the AAPI communities, to partner with community health centers, to look for nonprofits and trusted individuals in those communities to raise these issues, again, not just to deal with the virus, but to also deal with the other issues of inequity. As we move forward to both stop the virus, but then to rebuild a more inclusive America, a more just America, a more fair America, this will take all of us working together. And in closing, I think the strength of the United States of America is in its diversity. It is in one generation after another of immigrants coming here, bringing their religion, bringing their culture, bringing their traditions, all woven together in this fabric of diversity. So that is our strength. We should celebrate that. And I look forward to working with both APAICS as well as the Biden-Harris administration to make sure that we address the issues that are right in front of us. So again, thank you for your work, Madeline, and we look forward to working with you.
Thank you, Congressman Bera, for all of your leadership during these challenging times. It is now my privilege to introduce the moderator of our panel, John Yang, a correspondent for the PBS NewsHour. Over his long career in journalism, John has worked for outlets such as NBC News, ABC News, The Washington Post, The Wall Street Journal, Time, and The Boston Globe. Recognized as an award-winning journalist, he most recently covered the Trump administration and is currently reporting on major national issues from Washington, D.C. and across the country. Before I turn it over to John, audience members, please feel free to enter your questions into the chat function on Facebook or YouTube. John, I turn it over to you.
Madeline, thank you very much. And thank you very much, APAICS, for organizing this most important and most timely panel discussion. Most timely, not just panel discussion, but this entire program. Most timely because we now have an administration and a Congress, as we've seen in the COVID aid package that President Biden is going to be signing tomorrow, that is now looking at expanding healthcare coverage and building on the Affordable Care Act rather than trying to repeal it. We have a most talented and distinguished panel that I'd like to introduce to you now. First, Dr. Tanya Yee Vinton. Dr. Vinton is the medical director for the Nutrition Weight Management Center and co-chair of the Weight Wellness Committee at Baylor Scott and White in Dallas. Baylor Scott and White is the largest not-for-profit healthcare system in Texas. Robin Rodriguez is a professor of Asian American Studies at the University of California, Davis, and the current chair of that department. She's also the founding faculty director of the Bulusan Center for Filipinx Studies, which is the first of its kind in the University of California system. Rod Liu is founder and executive director of Asian Pacific Partners for Empowerment, Advocacy, and Leadership, which has the acronym APPEAL. It works on health justice issues for Asian Americans, Native Hawaiians, and Pacific Islanders. Joseph Sea is executive director of the Pacific Islander Community Association of Washington, co-chair of the National NHPI Policy Council, and co-chair of the local Undoing Institutional Racism Collaborative in King County, Washington, which is where Seattle is. And finally, last but certainly not least, Josie Howard, Chief Executive Officer and founder of We Are Oceania, which works to empower the Micronesian community in Hawaii while honoring the integrity of its diverse heritage. Welcome to you all. Thank you all for your time. Rod, I'd like to start with you. You've got your organization sort of got an overarching approach, an overarching view, sort of the 50,000-foot view of this issue. What do you see as the biggest challenges that the AA NHPI community faces in healthcare issues right now, whether it's systemic or structural issues, whether it's a condition or disease that's more prevalent but sort of unrecognized among the community, and especially as we sort of look beyond COVID, look beyond the pandemic. What do you see as the biggest challenges and issues ahead?
Thank you very much. If we were talking about health issues, I would look to the top 3 risk factors that result in 75% of heart disease and almost half of cancers. And those are the risk factors of diet, physical activity, and smoking. And smoking in particular is something that our organization has focused on because prior to COVID, it was the single most preventable cause of disease, both in our country and for Asian Americans and for Native Hawaiians and Pacific Islanders. Data is certainly an issue that is going to be talked about for a lot. And I think if you break down some of the data, and it's really important to recognize that Native Hawaiians and Pacific Islanders are a separate racial group than Asian Americans, you can certainly see some high risks due to smoking. And that directly connects to COVID. COVID is exacerbated by smoking, and those who are smokers are at higher risk for poorer outcomes, such as mortality due to COVID. So those all are important, but when it comes down to it, the fundamental issue is around racial inequities and racism as a public health issue.
I mean, talk about those issues, racism as a public health issue, and sort of they're also sort of systematic and sort of covert racism. Dr. Vinton, your expertise is in weight management and diet. Obesity, obviously a cause of a lot of, or associated with a lot of persistent and prevalent health conditions like diabetes, heart disease, and that sort of thing. But you are also there's also a difference, or in sort of the standard, the measurements that are made between for the AA NHPI community and the Caucasian community. Dr. Yiga, can you hear me? You want to talk about that? Tanya, I think you're muted. Tanya, can you hear?
Thank you. Yes,
Okay,
sorry.
thanks. Here we go.
All right. Thank you for that. So as I always tell my patients on their first visit, obesity is really a chronic medical disease. And when we say chronic medical disease, we're really also speaking to, there's a whole host of abnormal signals and hormones that are related to obesity. And really, that's not even the correct terminology, because we're really speaking about the disease of excess fat tissue. And this is really what creates all the medical diseases associated with what we call obesity. So like what you mentioned, diabetes, heart disease, stroke disease, but also 13 different cancers are associated with the disease of excess fat tissue. So specifically in the Asian community, Pacific Islanders, we have a much lower threshold for basically excess fat tissue. The BMI risks actually start way, way, way earlier. So what they've actually designated as higher risk actually starts at a BMI of 23. And those with a BMI of 26 and above are really at high risk for developing obesity-associated diseases, so such as diabetes, hypertension. Some of the data that we know about with COVID, definitely top 3 BMI over 30, especially over 35, and then also diabetes, hypertension. Again, those are all obesity, excess fat tissue associated diseases. And definitely because of this, Asians are much more at a higher risk, even at lower BMIs, which is dangerous because, you know, the focus has been if your BMI is over 30, that it affects you. But really for Asians, it starts much, much earlier. Absolutely. So one of the most important things is basically regular routine follow-ups, right? You want to at least probably have an annual physical with your physician where you get your basic metabolic panel checked, your insulin levels checked, your glucose levels checked, screening for prediabetes. Even if you're close to prediabetes, those are actually big early warning signs. Getting your blood pressure checked regularly, getting your cholesterol checked, because those are really markers early on that metabolic disease is setting in, even before, you know, really the bad diseases come later on.
Robin Rodriguez, I'd like to ask you what your view is. You working on Filipinx issues and with the Filipinx community. What do you see as the biggest issues in healthcare facing the community, and also sort of the disparities that there may be with the community?
Sure. Thank you for that question. I would say really, and this is not even just true only for the Filipinx community, I think this is true broadly for communities of color, is really white supremacy. And by that, I'm not just talking about the most virulent forms of white supremacy that we might think of. Certainly anti-Asian racism is hitting our communities. We know that there has been, people have been victimized in that way, but I'm also talking about structural racism. I'm also talking about unconscious bias. There are two domains, I think, where it really comes up and it has real implications, especially now in this moment. We're continuing to live in a pandemic. So the ways in which white supremacy manifests in research and data on one hand, and also in terms of responses to mental health. Now, in terms of research and data, I know there's going to be discussion on data disaggregation later, but I do want to speak to research. I do want to speak to the fact that, for example, just in the Filipinx community, it was 20 years ago that a federal agency funded a major national health survey called the Filipino American Epidemiological Survey, 20 years ago. And it really took intervention on the part of the community and an advocate at the state legislature here in California, Assemblymember Rob Bonta, before we were able to get an allocation that could then give us an opportunity to actually look at health and well-being for our community. And so luckily we were able to get that. And wasn't luck, of course, it was really hard work. But now what do we see? We see, of course, Filipinos, or the Filipinx community, 40% of us, of course, are working in the healthcare industry. Based on the data we've been able to collect since last year, 60% of our community are working as essential workers. So that means, of course, that we experience a kind of degree of risk with respect to COVID exposure that may not be the same for other Asian ethnic groups. Also in our survey, 80% of our respondents are reporting just kind of increased, heightened anxiety as a consequence of COVID. But now, what does this actually mean on the ground for our communities when we do not have this data? And again, this has to do in part with, the lack of investment, frankly, on the part of, local, state, and federal agencies in disaggregated data, but also a commitment to a racial equity lens when it comes to supporting research. We are hard pressed, for those of us who are committed to studying racial equity and uneven impacts across racial groups, hard pressed to get that kind of support from funding agencies. And really, this is an opportunity. This is a moment of racial reckoning. I really hope that lawmakers who are listening in will really look at how the National Science Foundation, how the NIH, and what sort of research is being supported. Because again, in terms of vaccine rollout, we are having a hard time getting vaccines rolled out, and even in the Sacramento region, to the most hard hit Asian American communities, like the Hmong community, like the Vietnamese community. We're struggling to get the attention of lawmakers to say, look, our communities are struggling in these particular ways. We need the testing. We need the vaccine. Now, the other issue, really, again, in terms of white supremacy, whether it's kind of in the virulent forms or unconscious bias, responses to mental health, a big issue that's hit the Filipino community, the Filipinx community. Recently has been the case of the killing of Angela Quinto, who in a manner very similar and eerily similar to the killing of George Floyd, who was subdued by a police officer who put a knee to his neck in what was supposed to be a response to mental health breakdown. Now, if mental health is going to be addressed with a use of force, as opposed to really the kinds of interventions that really are more appropriate to a mental health crisis. And again, if my community is representing is saying that 80% of us are suffering from mental health issues, this is, if we can't root out these problems of white supremacy in all of its manifestations, that's where we're going to continue to suffer. So again, I think it's really important to name it. We're in a moment when it needs to be named, and we need to address, at least for me, as in my vantage point as a scholar and a researcher, we need to address it when it comes to kind of commitments to racial equity lens and research, and also in responses to mental health.
You've raised a lot of issues that I'd like to return to, and I think sort of one overarching issue that I keep hearing, and that I'm so pleased that this panel is talking about, and this organization is talking about, is a reminder that the AA NHPI community is not monolithic. It's not homogeneous. We do have diversity within our own communities. And sort of on that point, I'd like to hear from Josie to talk about sort of the issues that she's dealing with in her work with the Micronesian community in Hawaii, and sort of the disparities she's seeing that she feels needs to be addressed, and maybe how she's addressing it through her organization. Josie, can you hear me? I think we have been having connection problems with Josie. Oh. I think we're having some connection problems with Josie that we're going to be working on. So Joseph, let me ask you sort of the same question. Your work with the Native Hawaiian Pacific Islander community across the country, but also where you are in Washington State, the sort of specific issues you're seeing, specific disparities you're seeing and that you're working on, and how your organizations are the organizations you're associated with are working on.
Yeah, sure. Thanks for the question, John Yang. Native Hawaiian Pacific Islanders, we have been hit. We are experiencing a different pandemic. Our communities are, experiencing death rates, alarming death rates. That are, way worse than other communities. And I just feel like there has been a lot of erasure in the ways that our communities do not have a seat at the table, right? With a lot of the COVID response work. And so Native Hawaiian Pacific Islander folks have been organizing really hard to really disaggregate from the problematic lumping of AAPI, right? Because we know that our issues are so unique, right? And we've been working really hard because, I feel like the aggregation not only lumps the funding, lumps political voice, really creates this scarcity of who gets to have a seat at the table, right? And NHPIs then for the most part is like either the sidekick or is erased from the table, right? And we know that what is being rolled out at the White House to mitigate COVID-19, if it's not directly funneled into our communities are not seeing any of that relief. And so Native Hawaiian Pacific Islanders on the continent have been working really, really hard to make sure that we are speaking as a distinct voice, as a distinct community, to really address the erasure. And here in Washington State, for example, in Eastern Washington, 60% of all cases were NHPIs, and we were 0.6% of the population in last June of 2020. These numbers, because of the erasure, and it really is, can we really value and honor the lives of NHPIs and really, make sure that that our political voice, our issues are not erased. And so this is our ask of our, Asian American allies, is to really think about us as a distinct community and really honor that. And we always talk about, let's disaggregate, but then we still linguistically lump everybody together as AAPI, AA NHPI, and I think it's really due time for us to not do that, right? Because then we're also not educating others who are not from our communities. They think that we're just some monolithic, a person, and that is not who we are. Thank you, John.
Joseph, very well said. I think that is something that the larger community has been focusing on. I can think of examples of where people have thought that we are as sort of one group. I do want to remind our viewers who are watching us on Facebook and on YouTube that you can submit your questions, which I can guarantee you will be better than mine, using the chat function. I'd like to sort of throw a question to everyone here, and whoever wants to address it can. We have heard so much in the past, actually in the past year of this pandemic, of sort of the blaming of Asians for this. I mean, it's just yesterday, former President Trump put out a statement where he again called it the Chinese flu. We have in recent days heard more and more reports of assaults on Asian American, Native Hawaiian, Pacific Islanders in the United States. Has anyone? I'd like to. This is something I didn't ask ahead of time, but I'm curious. Has anyone experienced this or had an experience with this during the past year, or felt this increase over the past year, and what could talk about that experience and talk about what we do about it, what can be done, together to fight this? Does anyone want to grab that or not? Or I guess not. Sort of going back to sort of picking up on what Dr. Vinton was talking about things that we as Asian American, Native Hawaiian, Pacific Islanders can do as patients. How do we get practitioners to recognize, as Dr. Vinton was talking about, the differences in BMI measurement between Asian American, Native Hawaiian, and Pacific Islanders and Caucasians? How do we get practitioners to be more aware of these issues? Tanya, do you want to? You talked a little bit about how you felt that patients should be pushing for follow-ups, but are there things that practitioners and doctors should be doing? Well, we seem to be having some internet difficulties with Tanya. I don't think she can hear me right now. Josie, are you back with us? Josie Howard, are you back with us? This is the nightmare of 2020 and 2021. The catchphrase, can you hear me? And I think you're muted. Are the two? I mean, actually, Robin, you talked about sort of this white supremacy in research, and I mean, even in the clinical trials for the COVID-19 vaccine, there was this push to get more and more people of color into these clinical trials. What can we do as a community to break that? And in terms of sort of pushing practitioners, pushing doctors, pushing the medical community to be more aware of the differences and
Sure.
to be more sensitive to them.
Sure. I mean, I do think it starts on some level. I think this is where our lawmakers can set the tone, and that is if our lawmakers at all levels of governance are commit to racial equity in driving kind of data collection, I think that can go a long way for all of our communities. And so, I mean, again, I know that's going to be raised later, but now in terms of research, I think part of the issue really is around kind of where funding priorities are put, not just to what extent our racial equity lenses in research are supported and funded by major agencies like the NIH, like the NSF, for instance, but also to what extent they're supporting researchers who are themselves from minoritized communities. And that really matters, because the truth is that there is this notion somehow that academics are bias-free. And yet it's clear. I mean, I think all of us are finally being heard. Those of us who've been clamoring for just this racial equity lens, that there is this bias that even kind of shapes how research questions that get asked, and of course, now in terms of even enrollment, right? When it comes to enrollment of minoritized communities, if you don't have researchers there coming from those sorts of communities who understand those experiences, understand the particular approach one might need to take to ensure that this enrollment happens, all of that is happening at multiple levels of the research process. And so, yes, that then means that we will be excluded, and and the most marginalized among us will be excluded. And so, I'm really hoping that at the end of this is that as structural racism is really addressed across institutions, that we really start to interrogate kind of this domain of research and research funding, because I think that as long as data is going to be what matters in terms of the vaccination rollout, in terms of even the allocation of other sorts of relief related to COVID, if we can't start with a racial equity lens in our research, that I don't know how programmatically in terms of policy that we're going to be able to adequately address COVID.
Excuse me, Tanya, are you back with us?
Yes.
Great. Sorry, I'm glad we got these problems resolved. So Robin was talking about sort of this issue at a research level, and you talked a little bit about in terms of weight management, the fact that AA NHPI patients have to sort of be more aware of follow-ups and that sort of thing. How can we get practitioners, medical care providers, to be more aware, more sensitive?
Very excellent question. That is actually part of, I would say, like personally with my goals in an obesity medicine specialist to educate other clinicians on obesity is really understanding that this disease can only be treated if patients are treated individually. You know, a lot of the failures in obesity treatment comes from the fact that we want to make everybody a cookie cutter solution. So most physicians, when you come to them, you ask for help with lifestyle guidance, diet guidance. They basically just tell you a very generic, okay, why don't you just go to the gym and exercise, go to Weight Watchers, go to Jenny Craig. Just a very cookie cutter solution, but that's not how we are. We're different, and especially with Asian Americans, even breaking down ethnic groups, one of the main things that we've learned through a lot of research is that our adipose tissue, our actual fat cells, are different compared to white counterparts. And this is what is causing us to be at a higher risk for metabolic disease and really at a much lower BMI set point. So a lot of this is helping clinicians understand that, yes, definitely Asian Americans, Pacific Islanders are much, much, much higher risk and much earlier. You have to be a lot more vigilant about screening. Usually when they come into the pre-diabetes range, they're extremely close to developing diabetes. So we can't wait on that. This is not a let's wait and see what happens. I can definitely tell you bad things will happen very soon. So the earlier and the more vigilant you are about treating the disease early on, it's super, super important.
Ron, let me ask you what sort of from your perspective running this your group that has a sort of a national advocacy perspective, what can community groups, what can corporations, what can nonprofit groups, what can government organizations, how can they all work together, and what can they do to try to address these issues?
Yeah, great question. Thank you for that. You know, I wanted to add, in addition to research and direct services, is the focus on prevention. And I think if there is one thing that we've learned from COVID is that with good prevention and good public health measures, a lot of harm and a lot of you know, serious disease from COVID can be prevented. And that's where we really like to focus on, because ultimately, if we can prevent things from happening in the first place, then we can resist a lot of the diseases that are out there. So with prevention is the importance of being able to tailor to different communities. And our lessons from working with many different communities, including the Asian American communities, is that we as communities ultimately have the answers on how to do that. And we can really involve the collaboration of multiple sectors to come up with those solutions. I wanted to come back real briefly to what you asked earlier around racism. And I think there may not have been direct responses because maybe none of us have experienced direct blatant racism. But there's another form of racism that I want to talk about, and that is implicit bias or unconscious racism. And that happens in the work that we are in the movements that we're in public health. And that's the other part of racism as a public health issue, is that we really need to be able to address all levels of racism, those that we can see and those that are really part of the system. And changing the system is so critical. And we all need to be a part of that, including community organizations, community health centers, the government, corporate sector, as well as many of the advocates that we are beginning to nurture as new leaders in our communities.
Ron, if you had one ask of the new administration, what would it be?
I would ask that we have more ability to invest in our communities. And that means a lot of things. That means, you know, financial resources, but programs that will build community power so that over time we have the ability to fully address our issues that are important, whether it's for Asian American communities or separately for Native Hawaiian Pacific Islander communities. That investment on all levels in terms of research, treatment, prevention, and policy is really key for us to have a very bright future that we all hope for.
Thank you. We are now have some questions from our viewers, which I'm glad to see. Question from Facebook. You know, we've talked about the differences between or among the various groups that make up the AA NHPI community. But we've also got a question about generational diversity. Someone's asking, how can we address some of the healthcare inequities for young AA NHPIs? I don't know exactly what they're getting at, but I presume it could be inequities in terms of coverage, in terms of insurance, whether you are not employed full time, whether you're part of the gig economy and may not have insurance from your employer. So anyone who wants to take that question about addressing inequities for young members of the AA NHPI community. Joseph, in your work in your community work in King County, have you come across this issue, or young people who feel that there are inequities in healthcare because of their age?
Yeah, thanks, John. For Native Hawaiian and Pacific Islander young people, we know that that there are some very particular issues that they're facing through the COVID response. A lot of it is, like Robin Rodriguez had mentioned, white supremacy is manifest in all the different systems that our communities are having to navigate. And for young people, they have a mental health system that does not know how to work with them. Right, our young people are left defenseless. Right, and when you look at our Native Hawaiian Pacific Islander communities, a lot of us, are not homeowners. We live primarily in intergenerational households, right? And so when we're having to school our the younger children at home, our older teenagers, older young people are having to also play the parental role, right? So you think about the ways that stress has culminated for especially my young people. So we're seeing, suicidal ideation go way up, right? Depression, all of that, and a crippled mental health system that is racist, right? And for Native Hawaiian Pacific Islander people, we have different values and cultural sort of spaces that address healing and wellness, and those are often not the CBOs or the programs that are funded directly by governments, right? Because there's layers and layers of requirements in order for you to receive mental health funding from the federal government, and so I see Dr. Ninez that is here. There's just so many layers of racism, specifically that Native Hawaiian Pacific Islanders have to, swim through in order for us to access any real supports, right? Any real supports to mitigate the harms that I think is impacting our young people. Thank you.
Robin, you work with college students at UC Davis. What sort of issues or do you hear them talk about or see them having in their lives?
Yeah, absolutely. I just to sort of echo what John has already said. These specific to the pandemic, definitely kind of mental health issues have come up over and over again, and to what extent universities and other kind of educational institutions have really equipped educators. I mean, I can certainly speak just as for myself. There wasn't sufficient support for us in the transition last year when shelter-in-place orders kind of became national. We were not really fully equipped. I think many faculty members were not getting sufficient guidance. Also, many times, right, there was a lack of flexibility, really, even around kind of academic standards. Meaning to say that, when we're living in a pandemic, it's really unreasonable for faculty to expect certain kinds of academic standards to be met, when especially when we have students who are living in, yes, kind of crowded multi-generational households where they're unable to really kind of maybe not even have access to the internet in a consistent and stable way, these sorts of things. But actually, when I was listening to that question, I wanted to speak to generational issues, but looking at elders, actually. So when I heard that question, what I was thinking about was actually kind of even how are we defining elder? So this is a big issue kind of from my vantage point, living in the greater Sacramento region, where you have really large concentrations of Southeast Asians, particularly Hmong people. One of the big issues that we're seeing is that there are these standards definitions of the elderly that also do not fit for the reality of so many of our communities. I just think about my mother-in-law. My mother-in-law is Hmong. She is a refugee who fled war-torn Laos, came to the United States, and under those conditions. So basically, from a standard definition of elder, she is not technically qualified to be able to receive the vaccine, in part because the papers that were used to kind of process her arrival were mistaken. She didn't have papers with her that could kind of, document her birth. And so her birth date basically is off. And so therefore doesn't, from a certain standard definition, might not be considered an elder. But even beyond that, there's so many people in the, kind of Southeast Asian community who've just gone through so much tremendous trauma. And that trauma is really embodied in so many ways, and that make them particularly vulnerable in this moment. And again, when we don't have this attentiveness, right, when our lens is not filtered through a kind of racial justice or racial equity lens, this is what falls out, and this is very, very concerning. And again, we're seeing that right now in the vaccination rollout. We have had to fight tooth and nail to get vaccines serving the most marginalized of Asian American Pacific Islander communities in the greater Sacramento region. It has been hard to get the attention of local health officials. And we have health officials that are referring to us as yellow people. I mean, these are the kinds of dynamics we're still dealing with in a region that has been home to Asian American and Pacific Islanders for decades, a century even. And so this is kind of, we're continuing to have to contend with this in the 21st century.
These are health officials who still have their jobs?
Well, thankfully, because we're mobilizing and raising these issues, no.
I got to tell you, when you said that, it made my head snap back. That in the 24th century, we have government officials who would use that terminology. Rod and Joseph, I don't know if you can speak to this, but we do have a question that is, and I apologize that we have internet connections with problems with Josie and we are unable to reach her, because this would be perfect for her. People talking about the inequities when it comes to the U.S. territories. For instance, Medicaid funding is capped at a low level for U.S. territories. Can either of you speak to that issue? Joseph or Rod?
Joseph, I will turn it over to you.
Yeah, so we actually do have our partners that steward that body of work for USAPI. The body of work that we're charged with is the stewardship of the health of Native Hawaiian Pacific Islanders that are living in the diaspora on the continents, right? But we know that there are significantly different challenges, right, in the policies that impacts the health of USAPI communities, especially like with our Samoan community during the diaspora. A lot of the flights that were coming out of the island, right, were basically because there are no supports back home, and they're only able to access some of that support in Hawaii. And we know that there has been such devastation as far as the ways that this pandemic has, essentially closed up borders. And there were communities that were living off island from American Samoa that were essentially stuck here without no access to any supports, right? And so we had to organize as Native Hawaiian Pacific Islander people that are living on the continent to support our folks that were unable to repatriate, right, to their home territories. And they were being charged at $600 every 4 months just to stay here in this country. And you think about the stress that a lot of the Pacific Islander families had to deal with to really be the economic supports for those members of families that were on this side, right? When the COVID shutdown happened. And so a lot of, the issues that impact, the policy issues that impact our families in the US API also impact our families here because of those really intimate dynamics and relationships that we have with our families back home.
I think we're going to try to see if Josie can get this, we can get this question to her somehow, and see if she can respond, particularly given her work with the Micronesian community about the disparities among the U.S. Between the mainland and the territories, the 50 states and the territories. I don't know that she can. I don't know. She can't hear us, so we're trying to send it to her in chat. But I also, it looks like her screen may be frozen. I apologize for this because I think that Josie's. I was particularly interested in hearing Josie on these issues. But I'm afraid that technology has defeated us today. So with that, I'd like to turn to each of you, as in our closing minutes here, for closing statements from each of you. And I'll go in the reverse order that I introduced you. Joseph, I'll turn to you first if you have some closing thoughts. I also call this section What John Should Have Asked. Because you can talk about issues that did not come up, the things that you wanted to say that didn't come up because of my questions. So what should I have asked, Joseph?
I think when we stage these national conferences, we have to really think critically about folks that are on the front line, right? Communities that are on the front line, and how do we create authentic relationships so those folks are actually, basically staging this conference for y'all, right? As opposed to people that are asking questions, making up questions about community, but how do we really co-design these spaces so that communities are really able to lift up the issues that are on the ground. And so I think the question, John, is how do we prepare better for next year? We've been asked on the West Coast to join the conference at 6:30, and Josie is joining at 4:30, a.m. in the morning. And so, just when we do these conferences, just thinking critically about how to deepen the partnership with community-based leaders and organizations that are on the ground doing the work with our communities.
Well said, to be aware and conscious of time zones. Rod, what closing thoughts do you have?
Well, I think that, as has been said, something that is a thread through all of this is systemic racism. And there really needs to be the acknowledgement that needs to be addressed at many levels, and a foundational level, even beyond just health, but in terms of other sectors, whether it's housing, education, the criminal justice system. Those all have to be as part of one. And I think there can be a lot learned from what I'm describing as equity collaboratives. So it is true that we need to develop tailored approaches for each of our subgroups, whether Asian American or separately Native Hawaiian Pacific Islanders. But at the same time, I think there can be a lot learned from aligning with other communities of color And we've been trying to do that. And in fact, the Tri-Congressional Caucus is an example of an entity that's modeled cross-cultural collaboration, because I think that as a community, as a whole, we have a lot to learn from each other. And we have that ability to answer the questions if the proper investment is made in our communities, and we have the chance to, truly develop that. I would just like to close my piece by just, again, acknowledging the efforts of frontline workers, essential workers, many of whom are immigrants, many of whom have been under attack by policies that have been developed against immigrants. And so for them to kind of see us through a very, very tough time is just, it really needs to be acknowledged and underscored.
Thanks, Rod. Thank you very much. And I think that's a very interesting and I think important comments about working across communities to reach common goals in fighting racism. Robin Rodriguez, what are your closing thoughts?
Really quickly, I just wanted to make sure, I just feel terrible that Josie hasn't been able to speak. I'm wondering if there's an opportunity to just sort of yield a little bit of time to give her a chance to type out a response to any of the questions. But if it's not possible, I can certainly close out.
I think we've asked her to do that, and I'm not quite sure. Victor or Chris, can you give me a little guidance? Well,
I could
Victor Yang or Chris Chan?
Oh.
This is everyone's, or at least my work from home year, all encapsulated in about 90 minutes here.
Well, I can certainly just sort of quickly speak to just say that, just sort of building on what Rod's just said. I mean, I would make a very specific kind of policy ask, really. I think this is an opportunity, certainly, especially if data is what's going to drive, right? If data on some level is going to drive resource allocation. Oh, I'm sorry. I'm not. I'm sort of just distracted by some audio in the background. But at any rate, if data is going to drive how resources are going to be allocated across the board, I think that this is an opportunity for all of the caucuses to really come together at the federal level to really dive deep and determine to what extent racial equity has been driving research and really supporting committing to kind of racial equity research. I think that is going to go a long way across a lot of domains of life for us.
I think that sort of this cross-caucus message, I think, is coming across very clearly here today. I think we are going to try, Victor, tell me if this is correct. We're going to try we have Josie on the phone, and we're going to try to use a phone connection. Is that right, Victor? So Josie is on, this is a combination of technologies here.
Hi, Josie. I think you're live now. If you'd like to give the audience your remarks.
Yes. Good morning, everyone. I want to thank you for this opportunity, and I also want to apologize for the technical difficulties. I just wanted to add to what my brother Joseph Sea had already talked about, and especially for our Pacific Island population here in Hawaii, to ensure equity, I think it's to empower our Pacific Islanders to have a voice at the highest policy making level, which means to honor our diverse heritages and at the same time our relationship. For example, we may come from small islands, but we're very diverse culturally and also with our relationship with the United States. For example, the COVA citizens, with that relationship, it really impacted our the access to adequate health care. As many of you may have heard about the Medicaid restoration, that's just an example of that. And also, I want to emphasize, with this respect for all, in data, the need to disaggregate data for Pacific Islanders. And I think to even further emphasize on that, within the Pacific Island, we are very diverse, and it will be very important and very crucial to disaggregate those data too. And I think last but not the least is just that. Thank you so much for this opportunity.
With your connection, but I'm very glad that you were able to give you to add your comments, because I think it is so very important, because as we talked about the diversity within the AA NHPI community, and I think that among the Pacific Islanders and among the U.S. territories, it is a growing issue and an important issue. Tanya, I wonder if you could finish us off with your closing comments.
Yes, thank you, John. So as I mentioned earlier, definitely Asian Americans, Pacific Islanders are higher risk for all the adipose tissue, excess adipose tissue related diseases, metabolic syndrome, and such. One of the biggest barriers to treatment of obesity currently is just access. So there's a lot of insurance that denies coverage for medications and even office visits to specialists like myself. So I really encourage our leaders, our policymakers, to support the Treat and Reduce Obesity Act. This is going to help increase access of care for patients with Medicare, and hopefully other commercial insurances will follow suit, to have access to obesity medicine specialists like myself. It also increases coverage and access to registered dietitians who can also deliver a lot of this information and helpful guidance in the treatment of obesity. So I really strongly encourage that to be considered if we are going to make any headway in improving our public health. Thank you.
Tanya Vinton, thank you very much. And thank you to Dr. Robin Rodriguez, to Rod Liu, to Joseph Saya, and our deep thanks and deep apologies, heartfelt apologies for our connection problems, to Josie Howard. Thank you all for very informative and thoughtful discussion. Thank you all for watching. And as has been said so many times during this discussion, so many members of the Asian American, Native Hawaiian, Pacific Islander community have been on the front lines of this fight against COVID for the past year. And so during the break, I hope that you will all take a look at this documentary from National Nurses United. Thank you very much.
I'm from Rojas City, Capiz, and that's in Panay Island, in the middle of the Philippines. It's in the Visayas region.
I was born in the Philippines, Angeles, Pampanga.
I was born and raised in Manila.
Oh, I am in the Ilocos region, the northern part of the Philippines. I was born there.
There are over 150,000 Filipino nurses working in the United States. Here they share their stories as immigrants, nurses, and union organizers.
We often think of Filipino nurses in the United States as a relatively new migration and a new immigrant group, but actually there's a much longer history that explains why so many Filipino nurses are in the United States.
The Philippine-American War at the turn of the 20th century lasted 3 years and killed an estimated 2 million Filipinos. The war was won by the Americans in 1902 and led to a U.S. government in the Philippine Islands.
And when the U.S. colonized the Philippines, they believed that they were bringing civilization to the archipelago. And in order to bring civilization, they also needed to bring Americanized education, and this included Americanized nursing training. Filipino nurse migrants comprise the largest group of foreign-trained nurses in the United States.
My parents are from Pampanga. When I was growing up and I was in high school, I look around and I said, you know, we are poor. We live in a squatter. And I want to help them.
So my mom actually came, you know how they say, fresh off the boat? My mom came on a boat, and she was only 25 years old. All she had was a sack of rice and an address to go to an aunt of hers.
There are different reasons why Filipino nurses are here. For job opportunities, for career advancement, for personal growth, and due to political oppression back home. Most people actually are aware that Marcos is being supported by U.S. government. And during Marcos' regime, if you're not cronies of Marcos, they take away your opportunities. They take your lands, your businesses. If you speak against them, they will imprison you. You will rot in jail. So my family is a anti-Marcos. My father was a political advisor, and Marcos, who didn't want him to become that powerful in our province, Marcos basically came after him. So we needed to get out of the country.
In 1983, we moved here from Georgia to here in Vallejo, and I got a job as a rehab nurse. And I encourage my children, be a nurse, because it's a good benefits, it's a stable job, and it's a very rewarding feeling that you help people. This is my firstborn, Gina. She's an RN. Tony, also an RN. And James Michael Jr., also an RN.
No, I didn't have any qualms joining CNA. My mom was part of a union, and I saw her go to different actions and strikes. She took me to the strike line. My mom was like, the union's going to protect you. If you have a situation with a union, you feel the strength of many people.
And these are the future nurses.
Mm-hmm. I'd love to be a nurse.
Mm-hmm.
Filipino nurses are no strangers to racism. They deal with institutional discrimination, along with workplace prejudice and harassment from managers, co-workers, and employers.
When I first started here as a nurse, I was discriminated because of my color and my accent as well. They would laugh behind my back because my accent was different. At the time, they thought because I'm a small Filipino, and they thought that I will not open my mouth, I won't say something.
As a nurse organizer, I would hear from others. The Filipino nurses were all meek, quiet, stuck to themselves. You don't have to worry about them. You don't have to talk to them. It was the ultimate objectification of a human being. What I experienced was not meek, was not weak. It was the opposite. It was courageous, it was bold, and willing to take on a tough fight, even though they were at the effect of very racist attitudes.
And I said, you know what? I need to talk to you guys here. You need to listen to me. You need to know where I'm coming from. So I basically stood up for myself.
The turning point of my involvement was in 1990 when I was trying to move to another position. According to the job posting, I meet all the requirements. The manager of the post-anesthesia care unit, she says, I cannot hire another Filipino in the unit because there are too many Filipinos. And I was stunned. Discrimination, like in their face. Maybe she thought I would not fight back because I'm Filipino, but I have to win the fight in order to tell our fellow workers that this should not happen to anybody.
CNA has shaped me to really be a strong, independent, dignified, knowledgeable advocate, with a great, strong moral compass.
There is a misconception that Filipino nurses are hard to organize, but if you go to any strike or any action where Filipino nurses work, the majority of the people you'll see on the line are Filipinos, especially in my area. You just have to let them know what the issues are. They'll bring food and they'll bring a good attitude and music, and they make it a party sometimes.
So let me ask you this. Whose hospital? Our hospital. Whose patients? Our patients. Hopefully Kaiser is listening.
I've known Zenny for a long time, and she would speak to so many nurses, and she would know not only their work schedules, but their personal schedules, their husband's schedules, and she's driven to organize nurses because she understands how important it is to grow the union.
I am the first Filipino American president elected for this union. I want to be an inspiration to all these young nurses and be there to fight for their rights and fight for our patients.
Nursing is not just at the bedside. Nursing is on the streets. Nursing is in the legislative branch. Nursing is in being a social advocate.
RNRN is a program that's from NNU, and they provide services and post-relief for it, be it Hawaiian or versus Hurricane Katrina. Having done the mission to Typhoon Hawaiian was probably one of the most rewarding experiences that I've ever done in my nursing career. Being an ambassador of my hospital and my union, it was profound.
And now that we're actually branching out as the Global Nurses United Union, we're working towards the best for the nurses and for the people of the world.
Our sister union in the Philippines has been recently titled a terrorist organization. To be labeled a terrorist organization is essentially designed to demobilize and silence your voice.
If we are classified as terrorists, it's just like justification if ever they would arrest us or kill us. In any way they want, anywhere and anytime they want.
We have Ms. Zenny Cortez, President of National Nurses United USA.
I came here today because we were invited by Filipino Nurses United. On behalf of National Nurses United, the largest union of nurses in the United States, let me say it's a privilege to be here with all of you. As a registered nurse for 4 decades, and I know a lot of you were not born 40 years ago, right? So I can be your grandma. I am a proud trade union activist and leader, and as someone with deep roots here in the Philippines, I feel very honored and grateful for the opportunity to speak to all of you today.
We appreciate the GNU's efforts in reaching out to us, and we are inspired by the achievements and the work of our colleagues from other countries.
Whether we're in the US or in the Philippines or any part of the world, our issues and struggles are the same. And ultimately, we are here for our patients, and we need to uplift our profession continuously.
We are globally united.
Filipino nurses and other foreign-trained health workers are very much the unsung heroes of healthcare delivery. And there are so many hospitals and healthcare institutions that would not be able to run as efficiently and effectively without the work of Filipino nurse migrants.
We have a lot of actually younger people, and some of them are just coming from the Philippines. I always tell them to be brave. Being in the union is power.
I do this work to promote our profession. I do this work because my daughter and my son are potential nurses. One of these days, I'm going to be a patient in that bed, and I want the nurses on the floors to have the tools and the staff they need to take care of me and my family.
30 years into my career, the rewarding thing is actually pulling it all together, the advocacy, and really feeling like you made an impact on someone's life.
I am there for the nurses, fighting for their rights. And, you know, when I go back to my bedside career, bedside practice, I'm there fighting for my patients.